How do I diagnose and treat depression as a psychiatrist? Most people learn about this thing in medical school, the DSM, which people call the Bible of psychiatry. It's not. It's really not. To qualify as having a major depressive episode, according to the DSM-5, you need 5 out of 9 criteria, and one of them has to be either depressed mood or loss of interest or pleasure. Then there are all of these other criteria. Most medical students learn these as SIG-E caps: sleep, interest, guilt, energy, concentration, appetite, psychomotor slowing, and suicidal ideation. But hang on a second, couldn't you meet those criteria for a bunch of different reasons? I mean, wouldn't you be kind of slowed down with bad appetite if you're just recovering from a major surgery? Mightn't you be really depressed and disinterested in things if you just had a major loss in your family? What if you're suffering with a massive weight of early life trauma? That's one of the big problems with the DSM, is that it's non-etiologic. It doesn't necessarily account for the etiology, the background, the story of how you got to where you are. It's kind of accounted for in terms of giving the clinician the license to determine what is the most likely diagnosis based on the symptom clusters that can be a bit pan-diagnostic. But a lot of patients wind up feeling really unseen and disenfranchised when they're told, you have major depressive disorder, when there isn't a coherent story to help them understand why and what they can do about it. So I brought in all of my evaluations. Not only am I going to ask about that, I'm also going to ask about any history of manic symptoms like reduced sleep need or increased goal-directed activity or risk-taking in an episodic fashion. I'll ask about hallucinations, delusions. I'll ask about all history of substance use. I'll ask about a trauma history of symptoms like ADHD symptoms, or symptoms of eating disorders. Take a developmental history, talk about early life attachment, and really try to figure out how this person became who they are. Now, I'm no wellness influencer here, but I'm also going to talk about wellness and lifestyle. Diet, sleep, exercise, social wellness, mindfulness, and purposefulness. Are there any gaping holes in this person's lifestyle balance that would lead anybody to feel depressed, and can we start making changes that'll help them feel better? Only now can we start thinking about treatment. If those questions I was asking about bipolar disorder or psychotic spectrum illnesses earlier were positive, we have to use a totally different type of therapy compared to the normal SSRIs. In fact, SSRIs can actually make those types of depression worse. If the history I got was more compatible with premenstrual dysphoric disorder, I might have to target treatment for that instead. Or you can actually give phasic sertraline at specific times in the menstrual cycle to make a massive difference in a woman's mood. Whether medications are opted for or not, therapy can be a very helpful tool as well, and improving healthy lifestyle habits is always beneficial. All that's just the tip of the iceberg, but I think it's pretty cool.